Hello and welcome to Health Services 411, a program designed to keep you updated, informed, and educated about activities, events, and policies of the BVI Health Services Authority. I'm your host, Marketing and Communications Manager, Natasha Ledsam. Hello, for today's 411, we're here at an open house for World Diabetes Day. Here behind of us, we have a number of things going on as we help to raise awareness about diabetes locally. So for today's 411, we're going to go through some of the stations, find out what's going on, get some wellness checks, and listen and learn to find out what we need to know regarding diabetes. Hello, we're here with Nurse Jesslyn Olive. Nurse Olive, tell us what's going on here today.
Hi, good morning. This morning we're having our open house. Today is World Diabetes Day. As you know, every year it's celebrated on November 14th. And in collaboration with the BVI Diabetes Association, we're having this open house.
So what type of stalls or booths do we have here today?
Okay, so we have our table with information pertaining to diabetes. We have testing for eye care or glaucoma. We also doing food care demonstration. At the back, you will see that we have the testing, the health screening. So we are doing blood pressures, blood sugars, your height, your weight. And then we also have nutritional advice for persons with or without diabetes. Mm-hmm. So at least you can know how to manage, because diabetes is a condition that can be prevented. So we are also giving the advice how to prevent it.
And what do you have over there in the corner?
Over there in the corner, that's the nutritional area. So in that area, you can find out all your portion sizes. I know some people always fret about when they see the small cups that they have to, measure. But this is what we're actually going towards, to prevent diabetes. Even if you have diabetes, you can live a normal life. So we're just trying to help persons to control diabetes. In the fact, those who have diabetes, to help them to control, while at the same time we're trying to prevent the disease.
Thank you, Nurse Olive.
You're welcome.
Good morning. Today we are recognizing World Diabetes Day. I'm not sure if you're aware of that, but today, the 14th of November, is celebrated worldwide as World Diabetes Day. So part of the committee's activities, there's a committee in the Health Service Authority chaired by Nurse Olive, and we have a health fair today. And at present, at this table, we are offering blood sugar screening, weight, height, and that indicates your body mass index, which tells you whether you're overweight, underweight, normal weight, or obese, and your blood pressure as well. Other tables, you can have the cholesterol check, compliments of the BVI Diabetes Association. Across the room, we have foot care education, eye examination as well, and these are all pertinent areas for a diabetic to pay attention to, because the early complications of the disease can be detected. So that's why we're focusing on the foot examination and the eye care as well. Okay. Yes.
We're here with Patricia Tony, Miss Tony. We're here at the diabetes table here as we celebrate World Diabetes Day. What message do you have for the community with regards to diabetes?
Well, diabetes is really a very serious problem now, especially in the BVI. We need to come to the BVI Diabetes Association. We test every day for diabetes, for blood pressure, blood sugar. So once you come and you get tested, we know exactly where you stand in this area.
Now, what's the importance of these tests that we're doing today with regards to diabetes awareness?
Well, it would let you know exactly your status, if you are diabetic or not. If you test your blood sugar and it's over Like for instance, we get a reading, fasting blood sugar is like 120. If you're diabetic, your fasting blood sugar should be under 120. If you're not a diabetic, your fasting blood sugar should be under 100. It can be from 70, 80, or even 95, and But if you have a high reading, then we recommend that you go to the doctor, get your blood tested, and then the doctor will tell you what to do then. With your blood pressure is 120 over 80. It can be lower. And then once you check your blood pressure and we see that it's over a period of time inside, then we recommend you go to the doctor, and the doctor will test and see exactly what your status is. But it's good to check your blood sugar because it can be it can be in your family, or it can be heredity, and it can be that you need an exercise. If you need to exercise and get your blood sugar test done, okay? So get tested, know your status, so that you'll be in good health.
Thank you.
All right.
So can you introduce yourself and tell us a bit about your table?
My name is Ms. Baptiste. I'm from Nutrition Services, and this table has a variety of display talking about portion sizes, the types of food that we would want you to eat or not want you to eat, because what's here necessarily doesn't mean that we want you to eat it. We want you to get into your portion control for the most part. It talks about fats. It also talks about some healthy recipes and some pamphlets that you can take away with you. With the portion size, there is the diabetic plates that we recommend. With the types of food, especially when it comes to a drink, when we display our juices, it's talking about high fructose corn syrup for the most part. And then the greens, which we want to push more of the greens and healthy fats.
Now, in relation to this mini health fair and some of the information that would have been obtained on the other side, for instance, people who may be slightly overweight, or people who might have a little bit or borderline or slightly high cholesterol, what would you recommend in terms of nutrition?
When it comes to cholesterol, we push whole grains. And when they came over, I mostly were pointing out some of the whole grain cereals that we would have had, with this having 15 grams of whole grain in it as a serving. I also pointed out the healthy fats. Instead of butter, we would have used vegetable margarines. This is almond butter, and peanut butter would be another healthy alternative as compared to bacon and ham that they might have had in their breakfast meal. And then I told them it comes down to portion control as well.
So in terms of the margarine, that's interesting. I always thought butter was better than margarine. What's the difference there, and why is margarine better than butter?
Good question. So margarine are plant-based. As you see here, this margarine has 80% vegetable oil. If this was, let's say, anchor butter is animal based, you're not going to see 80% vegetable oil. And also you would see this has 0 trans fat. So margarines, you're not going to have the trans fat, as opposed to anchor butter that would have the animal fat in there. Margarines are also solid at room temperature, but that doesn't dispel the fact that it's animal. It's not an animal based product.
So any other tips for persons with cholesterol to help them lower that, or even persons suffering a little bit from overweightness or even obesity, how they can manage that nutritionally?
The other tip I would leave with them is, let's do color in and white out. Color in would mean lots of whole grain pasta, whole grain rice, meaning brown rice. Quinoa is a nice whole grain. There's whole grain couscous. There are a lot of nice stuff out there on the market. If you're a dumpling lover, we recommend you using whole grain flour, 7 grain, 10 grain flour. A lot of folks ask about this today, and it's actually here on ground at Super Value. So get as much as, whole grain bread, multi-grain pita bread, whole grain pita bread. I would recommend, as opposed to the white bread with a lot of pep and leavening inside of it. So let's push the whole grains and the healthy fats. Omega-3s is for cholesterol. Cholesterol is a heart disease, and so we want to push the omega-3s. Olive oil, we do not cook with it. We use it raw, and we cook with canola oil as a healthy oil. So I would leave that tip with them.
Thank you very much.
Welcome. Thank you for stopping by in the Nutrition Food.
Hi, can you introduce yourself and tell us a little bit about your table?
I'm Dr. John Sefenemoko. I'm an optometrist. I work for Tutola Vision Center. We are here on the invitation of the Diabetic Association to take a look at people's eyes and attend to any problems they have with regards to eyes.
Now, with regards to the eyes, what's the linkages there between your eyes and diabetes?
Yeah, of course, you know what diabetes is. Diabetes has to do with the blood sugar level. The blood sugar, instead of going into the tissues to feed them with good quality blood, the sugar remains in the blood, and when that goes into the eye, it causes a lot of problems. For instance, it causes edema of the macula. The macula is the most sensitive area of the eye. All right, and because of poor quality of blood into the blood vessels get swollen, and there's leakage of fluid from the vessel itself. It causes what people call bleeding at the back and all that. So for those, and that we call blurred vision. The vision could be blurred from, say, not even seeing at all, just barely seeing, counting fingers. So that's the relationship. It's good. We inform patients if they are diabetic and all that, and they have blurry vision, for them to manage their diabetics properly, you know.
And in terms of the equipment that you have here, what exactly do you look for when you're doing your tests?
All right, this is basically to screen those who have refractive problems. You know, first timers who possibly have issues of not seeing well at distance or close up, or having strained vision or blurred vision, to tell them, you know, they are screened so that they will come over to have a comprehensive eye examination.
Thank you very much.
Good afternoon, everyone. Now, this afternoon, we just want to share a little bit about diabetes and foot care. Now, we have some facts of the human foot. Now, the human foot is one of the most complex and often neglected part of the body. Every step we take places 2.5 times of our body weight on the 26 bones that make up each foot. And it has been estimated that we walk 3 times around the planet in a lifetime. However, the foot is highly sensitive, and like any machine part, it suffers wear or damage when injured or stressed beyond its capacity. We want to have healthy feet. Healthy feet is really what we want. Now, why do you think diabetic foot care is important? It is important that we teach the patients the education that they need to maintain healthy feet. And in order to maintain healthy feet, we must make an effort to care for them, because this can prevent many foot problems that affects the feet. And the sooner we start caring for our feet, the sooner they will care for us. It is essential that our foot health becomes a daily routine. And some important steps I will share with you, okay? 1, we have to ensure that our blood glucose level is always within that normal range. We need to practice a healthy lifestyle. Example, the smoking. You know, we recognize that smoking contributes to foot problems in diabetics. Okay, so we have to avoid smoking. All right? We need to examine our feet daily and look for danger signs. All right? We can check the color of our feet. All right? They should be normal looking, no bruising, no discoloration, no cracks between our toes, no calluses, no ulcers. So when we check them, we would be able to identify if anything is abnormal if we check daily. Okay? So we also need to examine our shoes daily. Make sure there's no foreign objects in our shoes. We put them on.
Thank you for tuning in to BVI HSA's 411, where today was World Diabetes Day. We're here at the People's Hospital, where we attended an open house for diabetes awareness, got a few tests done, learned more about some of the risk factors and what can be done in terms of early detection and awareness for diabetes. So reporting for the BVI HSA, I am Marketing and Communications Manager Natasha Letzum. Thank you for tuning in.
Thank you for tuning in to this edition of Health Services 411. Please like and share this video and follow us at the pages below as we seek to improve the pulse of the people of the territory. Until next time, remember, your health is your wealth. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager Natasha Letzum.